swallowing difficult. Some older adults with severe dry mouth and untreated thrush have actually struggled to eat properly for months or years without realizing the dry mouth was the root cause. The fourth consequence is difficulty swallowing. As your mouth becomes drier, swallowing becomes harder. Dry food becomes nearly impossible to eat. You shift to softer foods automatically. Your diet becomes less varied. You might not get enough protein or fiber. You might start choking more easily on foods you used to eat without thinking. This is serious for older adults because malnutrition and choking are both major health risks that can lead to serious injury or hospitalization. The fifth consequence is that your dry mouth makes it harder to wear dentures or other dental appliances if you need them. Dentures rely on saliva to stay in place and feel comfortable. Dry mouth means dentures slip more easily. They are uncomfortable. Some people with severe dry mouth cannot wear dentures at all, even if they need them. And then there are the broader health consequences. If your dry mouth is caused by uncontrolled diabetes, and you have not addressed the diabetes, your blood sugar keeps climbing. If it is caused by sleep apnea, you are still getting starved of oxygen every night, and your risk of heart attack and stroke is still climbing. If it is caused by an autoimmune disease like Sjogren's, that disease keeps progressing. If it is caused by medications, and nobody adjusts them, you are still stuck. The dry mouth is not the only problem. It is often a symptom of a larger problem that needs attention. Here is what most people miss about this whole situation. They think dry mouth is a minor thing. They think they should just live with it. But actually, dry mouth is one of those symptoms that older adults can actually do something about. Unlike many of the frustrations that come with aging, this one often has real solutions. You just have to pay attention and take action. The first step is to actually notice it. If you are waking up with a dry mouth most mornings, do not dismiss it. Keep track of it. Does it happen every day? Does it happen only on certain nights? Does it get worse when you take certain medications or eat certain foods? Does it happen along with other symptoms like dry eyes, joint pain, or extreme tiredness? Start paying attention, because details matter. The second step is to mention it to your doctor. I know you hear this advice constantly, and it can feel like I am just saying the same thing everyone says. But genuinely, this is important. Your doctor needs to know you are waking up with chronic dry mouth. It is a real symptom that deserves evaluation. Your doctor can review your medications and see if any of them are causing it. Your doctor can screen you for conditions like diabetes or Sjogren's. Your doctor can check if you have sleep apnea. Your doctor can assess your hydration status. And most importantly, your doctor can help you identify the actual cause so you can address it. Now, if you are on multiple medications and you suspect they might be causing the dry mouth, do not stop taking them on your own. Some medications, like blood pressure medications, are critical for your health. Stopping them without medical guidance could be very dangerous. But do have an honest conversation with your doctor about the side effects. Ask if there are alternative medications that do not dry out your mouth as much. Sometimes there are. Sometimes you can switch to something that works just as well, but does not have that side effect. Sometimes you cannot, and you have to weigh the benefit of the medication against the side effect. That is a conversation to have with your doctor, not something to decide alone. If your dry mouth is caused by dehydration, the solution is simpler. You need to drink more water. Now, this sounds obvious, but many older adults genuinely do not drink enough because they either forget or because they do not like always needing to use the bathroom. But here is what matters. Proper hydration affects everything. Your memory, your balance, your energy, your digestion, your mood. If you are dehydrated, even mildly, you are not functioning at your best. One practical strategy is to drink a glass of water with each meal, and then drink water between meals too. Keep water where you can see it. Set a reminder on your phone if you have one. Make it a habit. It takes a few weeks for a habit to stick, but once it does, you stop noticing it, and it just becomes part of your routine. If your dry mouth is caused by sleep apnea, the solution might be a CPAP machine or another sleep apnea treatment. I know CPAP machines sound intimidating. I know people worry they will be uncomfortable. But here is the reality. They work. They improve sleep quality. They reduce your stroke and heart attack risk. They improve memory and daytime alertness. Many people who use them say they cannot believe how much better they feel once they adjust to wearing one. It might be uncomfortable for the first few weeks, but most people adapt, and the benefits are enormous. If your dry mouth is caused by Sjogren's syndrome or another autoimmune condition, there are treatments. There are immunosuppressive medications, and other therapies that can help manage it. There are also simple things like sugar-free lozenges, artificial saliva products, and mouth rinses specifically designed for dry mouth that can provide relief while you are being treated for the underlying condition. If your dry mouth is caused by diabetes, then getting better control of your blood sugar becomes even more important. It addresses both the diabetes and the dry mouth at the same time. If you smoke, stopping smoking will improve your saliva production almost immediately. Smoking damages your salivary glands and also increases your risk of cancer, heart disease, and respiratory disease. Stopping has benefits that ripple through your entire health. If you drink heavily, reducing alcohol intake will help too. Here is something else to do right now, today. Look at your medications. If you have a list, look at it. If you do not have a list, ask your pharmacy for one. Go through each medication and check what the common side effects are. You can look them up online, you can ask your pharmacist directly. The question you are asking is, does this medication list dry mouth as a side effect? Write down which ones do. Then bring this list to your next doctor appointment and have a conversation about whether the benefits of each medication outweigh the dry mouth side effect, or whether there might be alternatives. Also, try this simple test. Pay attention to whether your mouth is dry during the day or only in the morning. If it is only in the morning, it might be sleep apnea, mouth breathing at night, or just dehydration. If it is dry all day, it is more likely to be medications, Sjogren's, diabetes, or another systemic issue. This detail will help your doctor narrow down the cause. Another thing, do not overlook your oral health. If your mouth is dry, your teeth are at higher risk. Brush twice a day with fluoride toothpaste. Floss daily. See your dentist twice a year. Tell your dentist about your dry mouth so they can watch more carefully for cavities and gum disease. If you cannot afford regular dental care, look into community health centers. Many areas have sliding scale dental clinics. Your teeth are too important to skip. Consider using sugar-free lozenges or sugar-free gum to stimulate saliva production throughout the day. The act of sucking or chewing actually triggers your salivary glands to produce more saliva. It is a simple thing, but it works. And sugar-free is important because your teeth are already at higher risk with dry mouth, so you do not want to be adding sugar on top of that. There are also artificial saliva products available over the counter. Some people find these helpful, especially at night or when eating. They are not as good as your natural saliva, but they can provide relief and protection. And here is something that is sometimes overlooked: stress management. Since stress reduces saliva production, reducing stress can help increase it. This might mean meditation, gentle exercise like walking, time with family, hobbies you enjoy, or anything else that genuinely calms your nervous system. This is not just about dry mouth. Reducing stress helps your blood pressure, your blood sugar, your sleep, and your overall well-being, but it can also help with saliva production too. Now, I want to say something that matters. Getting older does not mean you have to accept every uncomfortable change as inevitable. A dry mouth is not an unavoidable part of aging. It is a sign that something specific is happening, and that something can usually be identified and addressed. It might take a conversation with your doctor. It might involve making small changes to your routine. It might mean switching a medication or treating an underlying condition, but you do not have to just live with it. The people who do best are the people who pay attention to these smaller symptoms: the dry mouth, the extra fatigue, the occasional dizziness, the change in how food tastes. These little signals are your body's way of communicating with you. Most people ignore them. They think they are just getting older. But if you pay attention, if you investigate, often you can find a solution. And when you do, everything gets better. Your teeth stay healthier, you eat better, you sleep better, you feel more like yourself. I want to ask you something, and I genuinely want to know what you think. In the comments, tell me, have you experienced chronic dry mouth? If you have, did you ever figure out what was causing it? Was it medication? Was it something your doctor diagnosed? Did treating it make a difference in how you felt? Or do you have a family member who has dealt with this and never really understood why? I am curious to hear what your experience has been, because the more we talk about these things openly, the more people realize they are not alone, and the more likely they are to actually take action instead of just suffering silently. Here is the thing I want you to take away from this conversation. Your body is constantly sending you messages. Dry mouth is one of those messages. It is not an emergency, but it is also not something to ignore. It is worth investigating. It is worth talking to your doctor about. And in most cases, once you understand the cause, you can do something about it. You can protect your teeth, you can improve your nutrition, you can sleep better, you can feel more energized, and you can do it starting right now, today, by paying attention to what your body is telling you. Thank you for taking the time to watch this. If this resonated with you, or if you learned something new, please let me know in the comments below. And if you want more videos about health changes that happen in your 60s, 70s, and beyond, make sure you click subscribe so you do not miss them. There are a lot of things that happen to our bodies that we think are just normal parts of aging, but actually, they are our body's way of asking for help. And when we learn to listen and take action, everything changes. Talk to you soon. Every morning you wake up and your mouth feels like sandpaper. You reach for water immediately, drink it down, and try to move forward with your day. It feels normal at your age. Maybe it's just how bodies work after 65 or 70 or 80. But here is what most people miss. That dry mouth you experience when you wake up is not just an inconvenience or a minor discomfort. It is your body sending you an important message that something deeper might be going wrong. And the reason most of us ignore it is simple. We think dry mouth is either just part of getting older, or we assume it will go away on its own. Neither of those things is true. In fact, chronic morning dry mouth can be a warning sign of several serious health problems that, if caught early, you can actually do something about right now. Let me be clear about something from the start. I am not saying every single time your mouth feels dry when you wake up that you have a major health crisis. That would be unfair and untrue. But I am saying that if you consistently wake up with a dry mouth, if it happens most mornings, if you have to drink water immediately just to feel normal, then your body is trying to tell you something. And that something matters. Especially because the conditions that cause chronic dry mouth in older adults often get worse over time, and they often affect things that matter most to you: your energy level, your memory, your ability to taste food, your mouth and tooth health, and even your independence. The first thing you need to understand is what dry mouth actually is. It is not a disease by itself. It is a symptom, and symptoms are messages. When your mouth is dry, it means your salivary glands are not producing enough saliva. Saliva is not just wet. It is actually a complex fluid loaded with protective compounds, minerals, and enzymes. Saliva keeps your mouth healthy, helps you chew and swallow, protects your teeth from decay, helps fight infections in your mouth, and even aids your digestion from the very first moment food enters your mouth. So when saliva production drops, especially at night or first thing in the morning, your whole mouth is left unprotected, and that is where problems begin to develop. Now, the big question is why? Why would your salivary glands stop working well? There are several major reasons, and understanding them is critical because some of them you can actually address. The first and most common reason, especially for people in their 60s, 70s, and 80s, is medications. If you are taking medications for blood pressure, depression, anxiety, allergies, or pain, there is a solid chance those medications are reducing your saliva flow. This is not rare. This is not an edge case. Thousands of older adults take multiple medications that have dry mouth as a documented side effect. Some people are taking 5, 7, even 10 medications, and they do not realize that 3 or 4 of them might be drying out their mouth every single night. This is where the problem becomes invisible. You took a blood pressure medication because your doctor needed to control your blood pressure. That is correct. That was necessary. But the medication dried out your mouth a little bit. Then you added an allergy medication, and that dried it out more. Then you added a pain reliever or an anxiety medication, and the effect kept compounding. Nobody told you this was happening because the drying happened slowly, so slowly that you adjusted to it without noticing. You just started needing more water. You started having a slightly harder time swallowing dry food. Your teeth started having more cavities than they used to, but you never connected those dots back to the medications. This happens to millions of people. The second major cause of morning dry mouth in older adults is a condition called Sjögren's syndrome. This is an autoimmune disease where your own immune system mistakenly attacks your moisture-producing glands, including your salivary glands and tear glands. You might have heard of it, you might not have, but it is important to know that it is not rare, and it is often missed or diagnosed very late. Women are much more likely to develop Sjögren's than men, especially as they get older, and the symptoms are often vague enough that older adults chalk it up to just getting older. Dry mouth, dry eyes, difficulty swallowing, joint pain, fatigue. Those could be Sjögren's, or they could be normal aging. How do you know? Most people do not. They just live with it. The third major reason some older adults wake up with a dry mouth is diabetes or pre-diabetes. High blood sugar actually changes the composition of your saliva and reduces how much you produce. If you have type 2 diabetes or even pre-diabetes and your blood sugar is not well controlled, one of the early warning signs might be waking up with a dry mouth. Now, if you already know you have diabetes, this is especially important because dry mouth combined with diabetes creates a terrible cycle. Dry mouth makes you more prone to infections and cavities. People with diabetes already have higher rates of gum disease and tooth loss. When you add dry mouth on top of that, the problem accelerates. Your teeth can fail faster, your gums can become infected, and infection in your mouth can actually make your blood sugar harder to control. It is a vicious cycle. The fourth reason is sleep apnea. If you have untreated sleep apnea, you spend much of the night breathing through your mouth instead of your nose. Mouth breathing all night long dries out your mouth severely, and you wake up feeling parched. But here is what makes sleep apnea particularly dangerous. It is not just about the dry mouth. Sleep apnea starves your brain and heart of oxygen while you sleep. It raises your blood pressure. It increases your risk of stroke and heart attack. It damages your memory and cognitive function. And many people have it without knowing it. They just think they snore. They do not realize they are actually stopping breathing dozens or hundreds of times per night. Waking up with a very dry mouth, combined with snoring, excessive daytime sleepiness, or gasping awake at night, is a strong signal to get checked for sleep apnea immediately. The fifth reason is simple dehydration. Some older adults do not drink enough water throughout the day. By the time you wake up, your mouth is dry because your body is genuinely dehydrated. This one is the easiest to address, which is actually good news. But it is important to understand that dehydration in older adults is serious. As you age, your sense of thirst becomes less acute. You might not feel thirsty even when you need water. And dehydration in older people can cause dizziness, falls, confusion, constipation, and urinary tract infections. So if you are waking up dry because you are dehydrated, that needs to change. There are a few other causes too. Radiation therapy or chemotherapy, if you have had cancer treatment, can damage salivary glands permanently. Certain autoimmune diseases, beyond Sjogren's, can reduce saliva. Thyroid problems, kidney disease, or liver disease can all affect saliva production. Smoking and heavy alcohol use both dry out your mouth. Even stress and anxiety can reduce saliva flow because stress affects your nervous system, which controls your salivary glands. The point is, there are real causes here. Dry mouth is not random. It is not just a sign of old age. It is a sign that something specific is happening in your body, and in many cases, you can identify what it is. Now, here is what happens when you ignore chronic dry mouth. This is important. This is where I want you to pay close attention. In the short term, a dry mouth feels uncomfortable, but it feels manageable. You drink more water, you use mouthwash, you keep going. But over weeks and months and years, ignoring dry mouth creates real health consequences. The first consequence is cavities and tooth decay. Your saliva protects your teeth from bacteria and decay. Without enough saliva, bacteria colonize your teeth more easily. You get cavities faster than you ever have before. Teeth that never had cavities suddenly have them. You might lose teeth earlier than you expected. And losing teeth is not just cosmetic. It changes how you eat, how you taste food, how you feel about yourself, and ultimately, it affects your nutrition. The second consequence is gum disease. Gum disease starts silently. Your gums become inflamed. They bleed when you brush. They recede. Then they get infected. Then you lose teeth. The whole progression can happen faster when your mouth is dry because your natural defenses are down. Many older adults end up wearing dentures not because they are old, but because they had chronic dry mouth that was never addressed. Their teeth simply could not be saved once the gum disease progressed far enough. The third consequence is fungal infections. A fungus called Candida lives in everyone's mouth, but your saliva keeps it under control. When saliva production drops,